Assalamualaikum. My name is Samia Fatma. I'm roll number 162 from batch 27. And today we are presenting our research topic of the title Screening of Colorectal Cancer in South Asia, a Systematic Review, under the supervision of Dr. Fariha Salman for the Department of Community Medicine. Um, no, I'm going to transfer the mic to Krishna, who is going to start the introduction.
Next slide. Hello. Colorectal cancer occurs when the cells that line the colon and the rectum become abnormal and grow out of control. So basically the cells break their normal regulatory barriers and thus become carcinogenic. It is the third most commonly diagnosed cancer around the world after breast and lung cancer, and the second leading cause of death, mostly due to delayed screening. The incidence of colon cancer in South Asia has increased over the years, and now it is the second most common cancer, as per research done in 2018, and it affects both genders equally. And the rise of colorectal cancer can be attributed to changes in our diet, especially red meats and everything, increased population aging, smoking, tobacco use, and sedentary lifestyles. Next. Because the symptoms of cancer do not appear until it is at a very advanced stage, screenings are our only way to improve the prognosis. The screenings help us diagnose it earlier and therefore treat it better. The survival rate is rising from 64 to 91% solely due to timely screening of colorectal cancer. The screening methods available for colorectal cancer are flexible sigmoidoscopy, colonoscopy, and fecal occult blood test. Sunena will elaborate on the methods. Thank you.
Assalamualaikum. I'm Sunana Tariq, roll number 149. Let's start with the screening methods. First of all, we have sigmoidoscopy. As the name suggests, in this method, we use a flexible endoscope to view the sigmoid colon and look for any abnormalities, like, for example, the polyps, bleeding, ulcers, etc. This is a less invasive procedure than colonoscopy. Next slide, please. If we find any abnormalities on the sigmoidoscope, we go for colonoscopy. And this we examine the entire colon for any abnormalities, like, for example, the polyps, as I've mentioned. Next slide. Fecal occult blood. In this test, we take the stool sample and microscopically check for the presence of RBCs. This is the first choice of screening test in the countries with the limited resources, like, for example, the lack of endoscopes or trained staff. It may be preferred because it is less invasive procedure. It can be a false negative, meaning that there may be the cancer or polyp might be present, but we do not find any significant findings on the fecal occult blood test, as most cancers or polyps do not bleed. Next, please. Barriers towards screening in South Asia. There is a lack of awareness among people. They need to be educated that the survival rate can be increased for 64 to 91% only by timely screening. There is fear of unfavorable outcomes, like people fear that they might have the cancer if they go for the colonoscopy or to the hospital. Third, there is socio-religious factors and a rising poverty rate. In Pakistan, 40 million people live below the poverty line. They do not have the basic resources available. So that is why there is a barrier in screening. Next, please. COVID-19 and colorectal cancer screening. In the period of COVID-19 pandemic, we have missed screening for the colon cancers because we intentionally did it to conserve resources, both the human and non-human resources, to prioritize emergencies and to reduce the transmission risk. Because obviously, all the patients screened for colon cancer do not have the cancer, so they do not need to come to the hospital at the time of pandemic. Due to this, many life years have been lost because the symptoms of colon cancers appear in the late stages. Next, please. The objective of our research is to determine the prevalence of colorectal cancer screening in South Asia, meaning that at this very particular point, what is the rate of screening for the colorectal cancers through all the methods mentioned above. Thank you.
Next. Assalamu alaikum. My name is Sayyida Batul Zara and roll number 150. I will be presenting material methods. Next. Since this is a systematic review, we used PRISMA guidelines for this research. PRISMA guidelines basically जो checklist होती है systematic review को लेके चलने के लिए, और इसको चेक भी इसी क्राइटेरिया की बेसिस पे किया जाता है. और बेसिकली मेटा एनालिसिस और सिस्टमैटिक रिव्यू के लिए जो है ये एक चेकलिस्ट होती है, और it is a acronym for preferred reporting items for systematic review and meta-analysis. Next. The search engines used for our research were basically PubMed, Google Scholar, and Cochrane. Next. The keywords we used in these research were colorectal cancer screening, sigmoidoscopy, colonoscopy, fecal occult blood test, South Asia. Name of each South Asian country was searched separately to find the specific research of the specific regions. Next. These are the South Asian countries. Since our research were based on the South Asian countries only, so the research articles relating to these countries were picked for our research. Next. Research strategy is basically the strategy we undertake for the systematic review and meta-analysis. We entered the articles on EndNote to remove the duplicates. Since we used 3 major websites, there were bound to be some duplicates. So we used EndNote, and then we screened them on the basis of title and then abstract. And then full text screening was carried out, and data was extracted, and the quality assessment was done. Next. Selection criteria, which basically includes the inclusion and exclusion criteria. Inclusion criteria is the criteria on the basis of which we include studies in our systematic review. So the original articles, observational studies, cross-sectional case cohort, case control, and cohort studies were included. The studies that describe the prevalence of colorectal cancer screening in South Asia were included. Next. Exclusion criteria is basically the criteria on the basis of which we do not include the study or exclude the study from the systematic review. We excluded case reports, reviews, editorials, abstracts and studies not having the full text with जिनका full text available नहीं था उनको हमने exclude किया है और the studies that were not in English language were excluded. Next.
Assalamu alaikum. Roshan Ahmed, roll number 295.
1 minute, 1 minute. 151 roll number is trying, but she couldn't connect, so her part was done by roll number 150. You can start.
मैम जो records identify किए गए थे results के लिए वो थे 21,113. उसमें से duplicate records move किए गए थे which were 900 और उसके बाद चेक किया गया था automation tools के ऊपर और उसके तहत भी 108 records move किए गए थे. मैम फिर स्क्रीनिंग आती है. स्क्रीनिंग के लिए 11 records आए थे जिसमें से 980 records exclude कर दिए गए थे और उसके बाद चेक किया गया था कि 125 records निकल आए थे असेसमेंट के लिए और उसमें से 25 थे रॉन्ग डिजाइन के ऊपर और 87 थे फुल टेक्स्ट जिनके नॉट अवेलेबल था. हम एंड पे रह गए थे 8 टोटल स्टडीज फॉर द रिव्यू. उसमें 7 थी ईरान से और 1 थी पाकिस्तान से. ओवर.
Assalamualaikum, my name is Saira, partner roll number 152. I'm going to explain the baseline characteristics that we found. In our study, we wrote the study titles, the name of the authors, year of publication, and country of study. Total studies were only 8, and out of these, 7 were from Iran and only 1 from Pakistan. Regarding the study design, all of these were cross-sectional studies. Their total participants ranged from 200 to 1,060. And we also mentioned their methodology as well during in our paper. Methodology, which method did they use for screening, whether they used fecal occult blood or colonoscopy or sigmoidoscopy. This is our research table that explains these findings. Out of these, you can say that a very different numbers of prevalence are there, so no specific trend could be determined. The highest prevalence rate was seen to be 59% in this research by Editor Chaudhary in 2016 based in Iran, and the lowest one was 2.6% in a study by Fariha Hassan et al. In 2017. Regarding the screening method, again, no specific trend could be recognized because almost 4 studies were using fecal occult blood and 4 studies mentioned colonoscopy as well. So we cannot say that which screening method is more preferred in South Asia. Moving on to the discussion, prevalence in Pakistan, a very low, as I've already mentioned, a very low screening rate of only 2.6% was reported in a Pakistan-based study by Fariha Hassan et al. The probable reasons might be that in our community there is very little knowledge about such procedures. And the second thing, being a lower middle income country, there are very few screening facilities available, and those that are available have very high cost. Next is the prevalence in Iran. A wide range of prevalence rates were obtained in the included Iran-based study, and the highest rate was 59% reported by Editor Chaudhary. As you have already seen that majority of our included studies were based in Iran. This may be due to the fact that colorectal cancer is the 4th most common cancer in Iran. So that may be the reason why they are doing so much research on this particular topic. Some other interesting findings that we discovered that uh, females get more screened as compared to males. A similar finding was also reported in a review done in the past in United Kingdom. This high rate of screening in females may be explained by the fact that females have more opportunities to be screened during their routine visits to the doctor. For example, they may go to the doctor for their menstrual problems, for their pregnancies, etc. Whereas men lack these kinds of health events, so that may be one of the reasons why they have lower screening rates as compared to females. Um, Passing on to the next.
Am I audible? I am Saira Ahmed and I'll present the strengths and limitations of the review. First, the strength of the review. Our search strategy was inclusive and we searched a wide range of databases, and then to enhance the sensitivity, we retrieved full text of all selected articles. Limitations were that only quantitative studies were included and most of the studies were from Iran and one was from Pakistan, so data doesn't represent all the South Asian countries. That's all from my side.
I'm Salman Khalid, roll number 298, batch number 27. The conclusion for the following presentation is that there is an overall very low prevalence of colorectal screening in the South Asian region, only 2.6 in Pakistan. And another reason for it could be that there are very limited research articles. As said earlier, there are only 7 from Iran and 1 from Pakistan and none other from other countries. Now, measures that could be taken to improve these numbers would be to increase awareness done by healthcare officials, the governments, and different healthcare programs so that more people opt for the screening programs. Thank you.